So typically the top 3 questions we get from patients, they want to know what is All-On-4. They want to know, am I a candidate? And they also want to know, how long does this process take? All-On-4 is a full arch restoration that replaces all of the missing teeth. That restoration is placed on 4 implants. Those 4 implants are placed in the bone where the teeth used to be. That restoration stays in, it fits, it functions, it feels like your natural teeth. The second most asked question is, am I a candidate for All-On-4? In my experience, oftentimes most patients are candidates. After we take a 3-dimensional scan, we can look at that. That gives us great detail to know if this is a good treatment solution for them. If they don't have adequate bone, then we can discuss options to augment, graft, add bone. But many times, most patients are a candidate. The third most frequent question that's asked is, how long does this take? They want to know clinically during their procedure, how long are they going to be here? And they want to know, how long is this process going to take? Implant dentistry has gotten quicker over the years, and the success rate's gotten better and better. But typically this procedure is a morning procedure. The procedure itself takes a few hours. Your teeth are removed, implants are placed, a restoration is typically placed that same day, and you leave with teeth. You leave with probably something that's more functional and more aesthetic than where we started that morning. After that morning, we're typically looking at 3 months of healing. Our patients leave with a restoration that's aesthetic, that's functional. They don't mind waiting that 3 months because they have something that's better than where we started. Discomfort's rather minimal. Typically we do not need narcotic medications. Our patients are typically back to work the next morning.